So good afternoon, everyone, and thank you for joining us for the last session of the 2021 Older Adults and Opioids webinar series. This series has been hosted by the Finger Lakes Geriatric Education Center. We are a HRSA-funded geriatric workforce enhancement program at the University of Rochester, and our co-sponsors are the Western New York Rural Area Health Education Center, or the R-AHEC, and the Monroe County Department of Public Health. My name is Laura Robinson, and I'm the program coordinator for the Finger Lakes Geriatric Education Center. And we are very honored and glad that you could join us here today. So just a few housekeeping items before we begin. Please use the chat button on your toolbar to type hello and introduce yourself with a name, job title, agency, and location. We will have people from across the state, if not the country, joining us today. And then we have the Q&A button in your toolbar as well that will allow you to type in a question for the presenter at any time during the presentation. We will check for questions as we go along through the presentation today. So now a little bit more about our sponsors. The Finger Lakes Geriatric Education Center has been continuously funded by HRSA since 1999. We are currently serving a 25-county area of the Finger Lakes region, but truly serve all of New York State through collaborations with many academic and community-based partners. Through educational initiatives targeting all healthcare providers and family caregivers, the goal of the FLGEC is to transform clinical training environments by integrating geriatrics into primary care delivery systems, resulting in an age-friendly health system, as well as dementia-friendly communities. The Monroe County Department of Public Health has a long history of collaboration with the University of Rochester and the Finger Lakes Geriatric Education Center. The Monroe County Department of Public Health provides direct public health services designed to protect the public from disease and environmental hazards and ensure community leadership for improved health status of individuals, families, and the environment. Their services include education, preventive services, and enforcement of health codes and medical policies. And the Western New York Rural Area Health Education Center is a nonprofit organization headquartered in Warsaw, New York, serving 12 counties, and their mission is to improve health and healthcare through education. The Rural Area Health Education Center addresses the health needs of its communities by focusing on health workforce development, preceptor development and student housing, pipeline programming, and rural healthcare technology infrastructure development. So now just to go through, we are certified for CME and social work credits for this session. So our planners and presenters have declared no conflicts of interest. And this session is worth 1 hour of CME or 1 hour of social work credits. And I will email out a link for you to claim those credits after the webinar has concluded. So I'm going to stop sharing my screen so that Charlotte can put her screen up while I introduce her. And so our featured speaker today is Charlotte Crawford, who is the Chief Executive Officer of Lake Plains Community Care Network. And Charlotte has been in the healthcare field for 42 years. She has worked as a nurse in long-term care, physicians' offices, and in acute care. She is a current New York State paramedic and has worked in paid services as well as volunteer for 36 years. For the last 21 years, she has worked at the Lake Plains Community Care Network, one of the rural health networks in New York State. The mission of the network is to keep rural health care a local matter by promoting collaboration and wellness and ensuring access to quality care. And with that mission in mind, Lake Plains is a partner to the Genesee, Orleans, Wyoming Opioid Task Force with a focus on assuring that those with a substance use disorder receive the best chance in achieving recovery. They recognize that it is a collaborative effort amongst many individuals and organizations in order to have a successful outcome. This Narcan training and having access to Narcan is an important component in this process. I will now turn the program over to Ms. Crawford.
Good afternoon. I am so happy everybody that's on here is here. And I'm going to be willing to bet that not a single one of you haven't heard of Narcan before. Thank you for the very wonderful introduction, Laura. I appreciate it. So we'll get right into it. We can skip over this, but I do have to let you know that I have no academic conflict of interest and I get no financial support for this other than the Narcan that I'll be sharing with you. So we're going to learn a little bit today about the signs and symptoms of an opioid overdose. It's really important to know those, and we don't treat the drugs, we treat the signs and symptoms. We're going to talk about the Good Samaritan Law as it pertains to Narcan, similar to CPR, but not the same. how to use Narcan to reverse an overdose, and some of the reporting that's done. This program is created so that anybody can provide Narcan to someone who's experiencing an overdose. It is funded from the grant from New York State Department of Health AIDS Institute. So back in 2006, it was made illegal for non-medical people to administer Narcan. This was huge. And not only did it make non-medical people, it also gave permission for people who do have a medical degree or nursing, doctors, podiatrists, whoever, to administer this in the field without a problem. Now, fortunately, actually, a majority of the heroin overdoses are witnessed. But the problem with that is if it's witnessed, frequently it's with someone who is also using. So they not necessarily want to call 911. They're afraid to. I'm going to tell you, I've trained numerous people who are in that boat. So what we've told them in those cases is don't not call. Do what you can do for them. If you have Narcan, administer it, roll them to their side so they don't aspirate, but don't not call. They also try ineffective things. I collect Narcan utilization forms, and I just read last night as I was doing data entry that someone decided that it would be a great idea to douse the person who was overdosing with water. Didn't kill him, thank goodness, didn't drown him. And the gentleman was able to get help and was reversed successfully when they finally decided to call 911 when the water didn't work. So a little bit of background is, and you all know, the opioid use and abuse is continuing, and it's going to continue as long as it's being prescribed by providers. They're not doing anything wrong. I firmly believe that, but people misuse what they've been given, or they share them with other people. And some people have a tendency to only have to take one or two, and they have formed an addiction to it. Okay, the biggest thing you have to remember with opioids is the most immediate complication is the respiratory depression. Respiratory depression is what you're actually treating. You don't care what drug they're taking. You're watching what their symptoms are. The respiratory depression leads to lack of oxygen in the brain or a hypoxic brain problem injury, and which can lead to death. Narcan is well recognized as the best to give during that. It works on opioids. This is one of my favorite slides because, as she said, I've been in EMS for a long time. And I can honestly tell you, when I first started in EMS, I could count on one hand and usually one or two fingers how many overdoses we took care of during the year. Now it is significantly more, and it's everybody. There isn't a single demographic that fits into the mold. It's everyone. We've had people that use the opioids, and I'm going to tell you a story. Years ago, not that long actually, I got called to a house as a paramedic for a semi-responsive elderly woman who was end of life for cancer. She was on fentanyl patches, and she has very caring, loving family. The one daughter had come over early in the morning, and mom was complaining about being in pain, so she gave her a fresh fentanyl patch. Okay. A couple hours later, another daughter came over and said, "How you doing, Mom?" She goes, "I've been having a lot of pain today." Mom wasn't, she was confused. So she told her she was having pain. So the daughter put another Narcan, not Narcan, she put another fentanyl patch on her. I got the call a couple hours later when mom wasn't very alert and wasn't breathing very well. I got there, got the medical history, found out what medication she was on, and asked, we were talking about it. The daughter said, "Well, I gave her a patch this morning, and then the other one got this look on her face was like, oh my gosh, so did I." So essentially, loving family tried to overdose their mom unintentionally. They did not mean to do that. So the ones we see most frequently are going to be the people who are experimenting, and those generally are children, because pure children, or young people, because peer pressure is a wonderful thing. And then we have a lot of people who are longtime users or been in rehab, and they come out and they're wonderful, loving friends. Hey, let's go out one more time, just one more time for old times. And the unfortunate thing that happens there is you have people who were used to taking a certain amount prior to their rehab, and now they're in a period of abstinence that they've had, even using what they're used to of using can set them over the edge and put them into an overdose. So there's been I've been to quite a few calls with those. I want to give you some data because I'm a data person. I love data. This is older data, and this is only for Genesee, Orleans, and Wyoming counties because this is from the Opioid Task Force. And you can see these are the deaths that have been directly attributed to opioids. The one thing you're going to see is in 2017, we had a real serious problem. 2017 was a bad year for us all the way around. Now the deaths per 100,000, which puts us on a level playing field with like Erie County and Monroe County. In 2017, Genesee County had more overdose deaths than Erie County and Monroe County. That is a huge, significant problem in a rural area. One thing I do track to the best of my absolute ability is Narcan administration. I will admit my data source crashed in 2020, so I've lost some data, but not all of it, but I don't have it processed yet. But you can see in 2018, as a result for the deaths and the overdoses we were having in 2017, there was an uptake in administration. 2019, not as much. And then we captured this data as well. Now, this does not illustrate 100% the ED visits that were categorized as an opioid drug overdose. These are generic. It could be anything. It could have been penicillin, but it did capture the overdoses. And again, it's only Genesee, Orleans, and Wyoming counties. We do capture the trainings that we do. And you can see 2015, 2016, 2017, that's when we started, was in 2015 doing trainings. 2017, there were not as many trainings. Could that be part of the result of why we had so many deaths? Don't know. There could be a correlation, we're not sure. But in 2018, we tripled the number of classes we had and the people that were trained and got Narcan out in the field. That's huge. 2020 hurt us with doing classes. 2021 is already off to a good start. So hopefully we're going to start seeing a shift in trends. Now, I know I have some doctors on here, and I bet you're very, very, very well aware of the I-STOP law that took effect in 2013. Totally overhauled the prescription monitoring program. It had all practitioners having to consult that program prior to prescribing. The beautiful thing with this, as an ER nurse, was the doctor could go in and find out if the person had prescriptions from other places for an opioid. So this was perfect for us because before this, we'd have to ask them, well, what pharmacy to use? And then we'd call the pharmacy and see what medications they were on. Good if they were honest about who they were getting their stuff from, or if they only gave us one and they were using other ones. So it didn't work. It didn't work. There was always a failure on that. People would come from other counties, other areas with complaints of pain and requesting medications. And because one of the biggest things we take care of people is for pain. So we were doing what we thought was right. And in fact, actually feeding the beast. We couldn't keep track and we couldn't figure out what people were doing. What happened with a lot of patients were doc shopping, especially those that were coming from out of the area looking for another place to get prescriptions. In 2013, when this was implemented, and then you can see where it took effect, the dramatic decrease in the individuals receiving prescriptions from greater than 5 practitioners and dispensed by greater than 5 pharmacies. So you can see the problem that we were having as ER nurses, finding out what scripts people were on, let alone where were they getting the medications from. Now, this is one of my favorite slides. I teach a lot of EMS and community members. And I tell people, don't care what the medication is, don't care. You're not going to do that. We're not going to memorize the list. We're caring about the symptoms. That's what we're looking at. Show them this list saying, you ever hear any of those medications? And generally, most of them have and may have taken them themselves. But I don't care. And I tell them, don't memorize, don't ask, don't care. The way the overdose occurs, it generally takes 1 to 3 hours, depending again on what they've taken. If they're using fentanyl or carfentanil, then it's going to be a much quicker effect. And frequently, if they're using the carfentanil, it's a needle in the arm death. That one is stronger and more potent than regular fentanyl, and fentanyl causes major issues as well. They mix a lot of the street drugs with fentanyl now. I just did a bunch of data entry yesterday, and I couldn't believe the number of times they notated that cocaine laced with fentanyl. So that was, you're seeing an upsurgence in cocaine. So anyways, opioids repress the urge to breathe. That's how opioids work when they've had too many. Decrease the response to the carbon dioxide, which is the body's normal response and urge to get them to take a breath. So it's blocking that. They're not going to breathe as effectively. So that leads to respiratory depression and then death. So basically slowed breath, breathing stops, heart stops, they die. Down and dirty real quick. Now, again, it takes about 1 to 3 hours, can be immediate, like we said. And the stages they can go through, but don't necessarily go through, include the nodding off. Looks like they haven't slept, they're tired, they're nodding off, but you can still wake them up. And now if they're snoring or loud breathing and they're still kind of, they're arousable, nodding off, reposition them. It could be just they're occluding their own airway, which is probably what they are doing. And the excessive drool that they may have can also occlude their airway. So you want to make sure that they can clear their airway. And this is part of the reason why when they're having an overdose and they're still not totally out of it, that you position them on their side to let the drainage drain out so they don't choke. Now, when they're going further down the hole, going more toward a total overdose, they are not responsive. These are people that you can do painful stimuli, take your knuckles and grind them in their chest, and they are not going to respond. They can have very shallow breathing. Now, that's what we're looking for, guys. A couple of the things you're going to look for with somebody who's overdosing is they're not responsive. I don't care how hard you shake them or how hard you rub their chest, they're not going to respond. The breathing is very shallow, very slow, if at all. If there's gurgling, it's because their airway is becoming obstructed with secretions. Skin color is really, really late symptoms. So that if they're dusky, blue lips and nails, they are just hanging on by a thread. You need to do something quickly. So just another way, people learn things differently. So opioids repress the urge to breathe. So the breathing slows down, carbon dioxide levels increase, breathing stops because the normal trigger that people experience to trigger regular breathing isn't being recognized by the body. So oxygen levels decrease, which gives you a hypoxic brain and can cause brain damage. All this takes time. The heart stops and they die. But if we can get in there and do something before the heart stops, it's a huge difference, and that's where things can be taken care of rather. Okay, is there any questions at this point? Okay, I'm gonna guess not. We'll keep going. Okay, Narcan. It's an opioid antagonist, which means it works against the opioid itself. There's 3 ways it can be administered. It can be administered intravenous, injectable, which is intramuscular, or intranasal. Intranasal is the one that is used in the field and the one that we dispense for people to use. It blocks the opioids from acting on the body. What it does is very successfully block the parking space where the opioid would attach to be absorbed in the body and used. Now, Narcan only works about 30 to 90 minutes. So that causes a problem too, because if they've taken a lot of an opioid, obviously they've taken too much, and the half-life for that medication is greater than 90 minutes, and they aren't transported to the hospital, they can go back into an overdose again. This is very significant on why it's really important for them to go. This is a quick diagram for people like me who are a visual learner of how the Narcan blocks where the opioids would bind. Now, the Good Samaritan Law, just like with the CPR Good Samaritan, you guys are encouraged to do the right thing, call for help, to give the Narcan, to do rescue breathing if they need it, if you've been trained. But it protects you from charges from prosecution for the following, which is drugs up to a felony offense, alcohol, marijuana, paraphernalia offenses, and sharing of drugs. You're not selling them, you're sharing them. Because the things it doesn't protect you from is the offenses involving sales for consideration or other benefit of gain, people in possession of A1 felony amounts of narcotics, which is more than 8 ounces, first-degree criminal possession of a controlled substance, first-degree criminal sale of a controlled substance. So if you're selling it, you're in trouble, you will be prosecuted. Operating as a major trafficker, arrest or charges for drug or alcohol possession for individuals with an open warrant for their arrest or are currently on probation and parole. Now you can see why people who have been in the system and maybe on parole or whatever are really hesitant to make that phone call because they're worried about going back to jail or being arrested. And then I put this on here so you can see the New York Penal Law 220.78. It's the 911 Good Samaritan Law pertaining to the Narcan. So some night, if you're bored, can't sleep, you can feel free to look it up and read it at length. And then this is the other part too. Now there's also an overdose law in New York State Public Health Law 3309. This is the one that protects non-medical people to administer Narcan from any kind of liability. It's emergency treatment, which is why it's not considered a professional practice, which is why people with a medical license have no problem and will not get in trouble for administering this. I have had somebody ask me one time about their insurance having a problem with it, and I was very confused on that because I didn't think anybody would have a problem with that. But I cannot answer that question, anything having to do with personal liability insurance, but it's supposed to completely protect you from having any kind of personal liability. I put this picture in because years ago, this was what was being dispensed, was the injectable. This was being dispensed to anybody because at that point in time, the nasal or the atomizer was not approved by the FDA for that medication to be administered. This is the only way it could be administered at that time. So I put it here for 2 reasons. One, to make that little note for you. And the other one is if you're ever at a scene and you see the little vials there laying around, make sure you look for a needle. We don't want anybody having a needle stick. So be aware of that. These are the original nasal Narcan that we were dispensing and training on. That white tip is the nasal atomizer. That's how the spray was actually broken down small enough to be absorbed. These, if they're still out there, are probably expired again, because I can tell you right now, I have not dispensed any of these in probably 3 years now, and they're max good for 2. So if you see those out there, that's probably an expired dose. We have now all switched to this. And the beauty of this one is, this is a 4 milligram dose, and the dosage from the old ones were 2 milligrams. So this gives you a double dose, but this is good because this is what they've found is needed. And just recently they came out with recommending 8 milligrams for administration, which is okay because you get two of these in each packet, each kit. But they're saying 8 milligrams for an initial dose too. But that's not That's not what we're teaching yet because I haven't been given the go-ahead to do that. But anyways, this is what we're using now. It's giving twice as much. Part of the problem with the other one, the old ones, is there was people needing 3, 4, 5 doses to get any kind of an effect. But what happens is your nasal mucosa can only absorb so much medication or liquid before it starts running down the back of your throat. So it wasn't doing any good. The docs from ECMC said, wait for a paramedic to get there, do your rescue breathing, wait for a paramedic to do the IV, because that's what they truly need. So we like the nose because the nose is easy. Great place to give medication. It's painless. There's no needles, no risk of contamination. I like this picture. I don't necessarily like that it shows the old atomizer, but I like it for the ability to show how it's dispensed in the mucosa and how it's absorbed. That's how you hold it. This is a single dose. You only use the one. It goes in one side, one nostril at a time, one nostril. And if you have to do the second one, you use the other nostril. Okay, back to that. Okay. Know the signs and symptoms. Patient's unresponsive. You can't wake them up. Breathing is slow. They're gurgling again. They've got an obstructed airway going on. And then their coloration changing. Check to see if they respond. Shake them, shout, yell, grind your knuckles, 5 to 10 seconds. If they still do not respond, call 911. Call 911 at this point, people, because there's other things that cause those symptoms. To be unresponsive, not breathing well, coloration changes. There's other medical issues that cause those problems that are not an overdose. We want to get EMS responding as quickly as possible to the help to get there in case that Narcan does not work and if that's not the problem. So when you do call, let them know that you think someone may have overdosed. Okay, if you're not sure, not comfortable saying that, just say I have an unresponsive person who's not breathing well. Okay. Open the airway. If you know CPR, bonus. And here's where I always throw the little plug in. If you don't know CPR, get into a class. It's really important that you get into a class. You need to know how to do CPR in order to help these people if the Narcan does not work. Because if they're not breathing and still have a pulse, you have to breathe for them. If you don't, they will stop breathing and their pulse will stop. So you're going to start with the 2 breaths. You're going to give them 2 breaths and only until you see their chest rise. Anybody who has CPR knows all this. You want to make sure their mouth is clear. And you keep doing this until they start breathing on their own, especially if the Narcan does not work. And then after you give the Narcan and the person wakes up, and I'm going to honestly tell you, most of the utilization forms that I get, they do wake up, various stages. Very few are combative. Most of them are alert. Some are a little more sedated still, but we're treating the respiratory effort. We don't care if they wake up and serve us tea. We want them to breathe. We want them to breathe adequately. So we want them to be able to, breathe, maintain their airway. That's our whole goal on this one. Tell them not to take any more drugs. And the reason I'm saying this is frequently, many people versed will need to go. That is frequently their best way to get help. It's also frequently their first introduction to help. And we want them to be able to have that to help them move forward in their recovery. Narcan can repeat it in 2 to 3 minutes, 2 to 5, 3 to 5, whatever, just as long as you know that some point in time, that's where they're going to be repeated. Again, 30 to 90 minutes, stay with them. Make sure you tell the ambulance what you've given and how they were and how they are now. If you have to leave, put them on their side to prevent from choking. Again, really urge them to go to the hospital. It's very, very important. This is how you support the person on their sides. Again, urge them not to take any more drugs. Some are upset that you've reversed, even if you tell them, listen, you weren't breathing, which kind of blows my mind, but sometimes they're upset. They don't believe you that that's what's happened. Some of the common side effects: nausea, vomiting, diarrhea, hypertension, tachycardia, and unmasking of other ingestions, which means if they've taken other medications on top of it, then you may get those side effects as well. But everything pales in comparison to danger of not breathing. So this is what we really want to do, is get the person breathing adequately on their own. So can you give Narcan if you're not sure what they took? Absolutely. If that is exactly what I've told people, and this is what I preach to people, don't care. If they've got these signs and symptoms, give them the Narcan. If it's an opioid, it should work. If it's not a big deal. Does not make a difference if it is prescription or street. An opioid is an opioid. Narcan works on it. So if you give it to someone who's not overdosing on an opioid, they get a wet nose. We don't care. At least we know. And that's why you call 911 right away, to make sure that they do get the help they need. This is a quick review. Don't happen quickly, 1 to 3 minutes. They go through the stages, still arousable, snoring. They may be gurgling because they're starting to lose their airway. Overdose, they're unresponsive. You can't wake them up. The breathing is very shallow. If it's present, you may get the skin changes, and then the fatal overdose is death. Okay, we have people complete the Narcan utilization forms. They can be scanned to the state so they can collect data. If it comes back to me, the form comes back to me, I will replace the kit so you can get another kit. Narcan storage. Make sure room temperature between 59 and 77 degrees. The new Narcan that's coming out has a better tolerance to heat and cold. Still shouldn't be frozen. It says protect from light. It's in a packaging where you wouldn't have to worry about it. It does have an expiration date. Generally, it's 2 years. The expiration date is on the packaging. Now, this is a little more information for people. Fentanyl, more powerful than heroin and 1/10 of the cost. It's cheap, and that's why they cut the heroin with the fentanyl, because a kilogram of fentanyl costs about $8,000 compared to $80,000 for heroin. That's just to give you a little bit of a visual of what would kill you. That amount will kill you. We tell people to protect themselves. I do this training to a lot of law enforcement, EMS, and the like, so we always have this in here for them. Dust masks if they're going someplace where it's aerosolized. Always wear your gloves because it prevents skin contamination. Safety glasses because your eyes are a mucosal membrane. Washing your hands with soap and water. What I'm going to tell you is don't use alcohol-based cleansers on your hands when you've been exposed to anything. Use the soap and water. And removing and clean your uniform and clothing. I'm going to tell you a real quick story. There was a law enforcement officer who stopped at a car that was pulled over, and the driver was unresponsive. Went to take the driver, pulled him out of the car because they weren't breathing well, laid him on the ground, took care of them. EMS showed up. He looked down, he had some white on his shirt, wiped it off, didn't think anything of it, was going back to his car. And they said he went unresponsive. He had been exposed to a large enough quantity of whatever that he caused an overdose on himself. Now, the reason I encourage people to, if you're in that kind of situation, remove and clean your uniform, because what would have happened if he didn't do that, if he didn't cause his own overdose, and he'd gone home and was saying goodnight to his little girl and gave her a hug, and some of that was inhaled by her and she never woke up. So I like to drill that home, that protecting yourself and your family is really important. Now, I don't know how many people know about the NCAP program. The NCAP program is if you have insurance and you have prescription coverage in it, you can go to a pharmacy that carries that program, which the vast majority, especially the chains, do. And it'll cover up to $40 in prescriptions of the copay for Narcan. And I've not heard anywhere where Narcan that you didn't have any out-of-pocket costs because the $40 covers it. Okay, so this is something you're going to want to know about. Okay, here's my contact information if you have any questions going forward, or if you ever want to reach out to me and ask me anything. If you call the office number, we're pretty much not working in our office, but we have somebody who will answer the phone and they will contact me, but that is my current email. So I'm done with this, and I'm going to now go back and show you a couple videos. But before I do we have any questions?
Do not see any questions in the Q&A.
Okay, then I am going to share a video. As soon as I come back to the share again. Oh, hit the wrong button again. Okay, this is a video that's been put up by Narcan.
Narcan nasal spray is an emergency treatment for a known or suspected opioid overdose. The appropriate use of Narcan nasal spray can help you save a life. Narcan nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. If you encounter someone who is unresponsive and you suspect an overdose, first shake their shoulders and shout their name.
Kevin.
Ask if he or she is okay.
Hey, can you hear me?
Check for signs of an overdose, unresponsive to touch or voice. Breathing is slow, uneven, or has stopped. Snoring, gasping, or gurgling sounds. Fingernails or lips are blue or purple. Administer Narcan nasal spray as quickly as possible if someone is unresponsive and an opioid overdose is suspected, even when in doubt, because prolonged respiratory depression may result in damage to the central nervous system or even death. Lay the person on their back to receive a dose of Narcan nasal spray. Remove Narcan nasal spray from the box. Peel back the tab with the circle to open it. Remove and review the printed quick start guide inside the package. Hold the Narcan nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Do not press the plunger to test or prime the device. If you do, you will waste all or part of the dose of medication. Tilt the person's head back and provide support under the neck with your hand. Gently insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the person's nose. Press the plunger firmly to give the full dose of Narcan nasal spray. Remove the device from the nostril after giving the dose. After you have given this medication, seek emergency help right away. Narcan nasal spray is not a substitute for emergency medical care.
I'm with somebody who stopped breathing. I think they've had an overdose.
Move the person on their side after giving Narcan nasal spray. If possible, put their hands under their head and bend their upper leg forward. This helps prevent the person from rolling onto their stomach. This is known as the recovery position. Continue to watch the person closely. If they do not wake up or respond to your voice or touch, or if they do not seem to be breathing normally within 2 to 3 minutes, use a new Narcan nasal spray to give an additional dose in the other nostril. Acute opiate withdrawal symptoms may occur from use of Narcan nasal spray in patients who are opioid dependent. Symptoms include body aches, diarrhea, increased heart rate or tachycardia, fever, runny nose, sneezing, goosebumps, also known as piloerection, sweating, yawning, nausea or vomiting, nervousness, restlessness or irritability, shivering or trembling, abdominal cramps, weakness, and increased blood pressure. When the emergency is over, put the Narcan nasal spray back in its box and throw it away in a place that is away from the reach of children.
Okay. And there we go. Sorry about that. I was having problems closing it.
We do have a couple questions. if
I
that's
see
okay.
that. Okay.
So the first one is in the Q&A. It says, how severe and lasting is the brain damage from lack of oxygen?
You know, I wish I had the medical background to answer that question. I think a lot of it has to do with the length of time they've gone without oxygen. If you can catch them before they stop breathing, it's going to be a much more minimal. It's more or less, it's going to be worse if it is prolonged. And again, I will defer that to people with MD after their name because I don't. I can't honestly tell you, or a neurologist. I'm sorry.
That's okay. We have a couple that maybe could put some information in the chat. And then the next question is, I've been carrying 2 nasal spray containers of Narcan after a professional training. I'm seeing it expired in 2019. How do I get updated ones?
Well, here's good news for you. You will be getting new kits from this training. I'm going to be delivering them to R-AHEC, and they are going to be nice enough to mail them out to you.
Thanks so much for that, Charlotte.
Anything else?
Not right now.
Okay, in that case, in that video, the one thing you saw them do, 2 things. First of all, no gloves, which working in the healthcare field hit me hard. The other one is the administering before calling 911. Always call 911. You can do both at the same time, but get on that phone and just make sure you get them rolling. Okay. The other video I'm going to show you is regarding fentanyl. And I will cut this one out early because it tends to, oh, hang on. I have to share my screen first. Always works better. As soon as I find it. That's not it. Okay. Let me see if I can you see a black screen right now?
Yes, we can.
You do see it?
Yes.
Okay. Okay, this one is regarding fentanyl that I showed at the trainings just to explain a little bit more about it.
Jefferson County 911.
There's a gentleman in the bathroom.
Is the door locked or?
Yes, and we don't have a key.
2182 responding to West Washington Street.
The help is on the way.
Okay.
Agree. So the EMS assist at 328 West Washington Street.
10-4. 103 Jefferson. You can change this one overdose if you haven't already.
What do you want?
Just give me one.
That's enough.
Oh, I wonder what's going on here. Let's go ahead and light him up. He's going out the window! Clear the room!
Got a gun.
Fentanyl is a synthetic opioid that's becoming more and more prevalent in the drug world. It's actually more potent than heroin or morphine, and even some of its analogs, such as carfentanil, are much more potent than that. Fentanyl has been seen in powder, tablet, capsule, rock, nasal spray. The forms are always changing. What we've seen in the last few years with fentanyl is a rise in the number of deaths associated with its use.
First responders are increasingly likely to encounter fentanyl in the line of duty. We want to make sure that they have the facts to keep them safe.
I got this on my hands.
Well, one myth is that just touching any amount of fentanyl is likely to cause severe illness or injury or even death, and that's just not true. Incidental skin contact with fentanyl.
Hey man, what's going on?
Fentanyl can be washed off with soap and water.
Wash your hands. You'll be okay.
Think?
Yes.
All right.
You don't want to use hand sanitizer because that can actually potentially increase the absorption of fentanyl. Exposure can come in many ways: through skin contact, through the mucous membranes of your mouth, your eyes, or the most significant risk is from aerosolized airborne powder. Another myth is that PPE or personal protective equipment won't protect you from fentanyl. And the truth is that in most circumstances, it will offer a significant level of protection. And gloves will protect from the skin exposure, skin contamination of your hands. The respirator mask will prevent the inhalation of an airborne powder. Wearing eye protection can prevent the exposure through the mucous membranes of your eyes.
Hey, can you check her breathing?
All right. Ma'am, are you all right? And can you hear me?
Should someone become exposed to fentanyl, some of the signs or symptoms that you would see would be drowsiness or unresponsiveness, slow or no breathing, and then constricted or pinpoint pupils. Those are the signs or symptoms you want to look for in yourself or in your partner or in someone that you're responding to.
She's not breathing. Better call EMS.
960, Hotel 16.
Hotel 160.
Yes, can you get EMS on the way to 301 Jasper Street, room 250?
Sending EMS to 301 Jasper Street, room 250.
They're on their way.
If you think you've been exposed to a substance that could be fentanyl, you want to take that very seriously. You want to alert a supervisor or a buddy, tell them what you think is going on. And the first step is to prevent any further contamination. The second step is to not touch your eyes, your nose, your mouth. That way you'll prevent further exposure. Third step is to simply wash the area with soap and water. And then finally, if you think your clothes or some of your protective materials have been exposed or contaminated, you want to remove those through your standard decontamination protocols. More and more first responders are being provided with naloxone for use in the line of duty. You want to administer the naloxone per your established protocols. Naloxone is a very safe medication, and it can very rapidly and effectively reverse the effects of fentanyl, and it can be life-saving.
How you feeling?
Okay.
Having any trouble breathing or anything?
No, I did get a little on my skin accidentally. I washed it off with soap and water though, and then gloved up.
Okay, we'll check your pulse real quick.
Okay.
The threat of fentanyl is real, but we're showing a multi-layered defense that will keep first responders safe while they do their job and keep the rest of us safe.
Okay. I don't think we need to see all the other stuff that goes along with that. The reason I show that is just so people can understand a little more about the fentanyl aspect. And then I have one more. The one more is actually produced by the Gao region. So if any of you are used or from this area, and if you give me 30 seconds here, once again, I didn't share my screen. Okay. Now, could you see the black screen again? I'm sorry, I just want to double check before I start it.
Yes, we can.
Okay. This was produced locally to explain the importance of getting help with after a Narcan administration.
An opioid overdose is a terrifying experience. Giving a life-saving dose of Narcan is a critical first step. Getting checked out by a medical professional is the next step.
It's important for a person to come to the hospital after Narcan has been administered in the field so that we can monitor them. When they take an opiate and they have the effects of that opiate in their system, the Narcan reverses it for a short period of time. When they come into the emergency room, we can monitor them, and if that opiate is still in their system, we can give the appropriate treatment.
It's important to come to the hospital after you receive Narcan for a couple different reasons. First and foremost, to make sure that you're okay physically. We're able to check vital signs and make sure that you've recovered from the overdose itself.
The other piece of it is looking not at just the immediate medical issues, but some of the ongoing medical care that people sometimes are not getting. Everything from hepatitis C testing to HIV testing. There can often be issues with infections that injectable drug users are prone to, and just basic primary care services.
Unfortunately, every time somebody overdoses, that person is a much higher risk of overdosing in the future. So coming in an emergency room really opens up the opportunity that we can connect both the patient, the person who overdosed, and their family or their loved ones with support.
When they get to the ER, they could be offered a peer to come in and support them and to sit with their families, because it's a scary time. There's a peer advocate on call 24 hours a day. If they feel like they're gonna use, we can talk to them or go meet them.
We're not doctors. We're not, counselors. We are support for them. Our main mission is to come alongside of them and help them in recovery. We work with the families as well. We will talk with them about the services we provide. We'll provide Narcan training for them and the patient. We'll do whatever we have to do.
I can't even imagine how frightening an overdose event would be. Friends or family members that might be scared, to have them be connected to resources, to a peer, someone who understands substance use disorder, addiction, and the path to recovery, and to have that bridge be established following an overdose event. What a ripe opportunity to enter treatment and begin recovery.
Any life lost to an overdose and any overdoses that are occurring is too many. And we as a community are really rallying together. We've worked hard to identify resources. We want to be able to help our neighbors, help our loved ones, and make sure that they can succeed in their recovery process.
Peer advocate, this is Nicole. We want to be here for your good days, and we want to be here to help you in your bad days. You may feel very alone. We are here to be with you.
How long have you been using? You can't do it alone. We need people in our lives, and that's what we do. We just want to come alongside people and be a support to them and help them succeed in their recovery.
Together,
we can tackle
the serious problem
of opioid addiction.
The serious problem of opioid addiction.
For more information, to become involved, or to get a replacement Narcan kit, visit our website.
Okay. That introduced peer advocates, which is something that we've been working on in this region to get people to help that is on, meets them where they're at. No matter where they are in the recovery process, they will meet them where they're at and help them to the next stages. They don't push anything on them. And the vast majority of the peers are in recovery themselves and have been for a long time and have received very specific training to help them. Okay, any other questions?
So I had a couple that were from the registration. So how often is the fear of prosecution the reason for people not helping or not administering Narcan?
I'm going to tell you that has decreased immensely with education and training. It's not a problem anymore. I've only had one person in the last 2 years that brought up the insurance issue, which really boggled me. I was not sure. I don't understand it. And they never came back to me with any written material on it. So not sure.
Okay, and how can we increase the number of people that are Narcan trained? And do you know what the rates are? Like how many people get this training?
It's hard. We can offer trainings and people don't come. And that's the hard part. I know the first responders, hands down, because that's what they do. They respond to emergencies. So they want to have the Narcan in their hand. And we try to make sure that they have it individually. So that if they're out in public and not with their squads or whatever, they still have the resources to use. We've had people come and ask for Narcan. The youngest person I've trained was 12. 12 years old, had a family member who had overdosed, and they were the ones that found him, and they were terrified. They didn't know what to do, so we trained them. We also taught them some very basic CPR for at least rescue breathing. The kid was terrified and didn't want it to happen again. So we'll do that. I don't mind doing that. I'll do a one-on-one with somebody who's in that kind of a situation. I don't care.
Thank you. And then are there any issues for the safe disposal of outdated Narcan?
I'm going to tell you, you can throw it away if you want to. As long as there is no needle attached to it, it can be thrown away, disposed as you would any other kind of pharmaceutical. Usually I dispense it, so there's nothing in there, so people don't think they're getting something that works. If it's outdated, I dispense it so there's nothing there and then throw away the empty container, just like you would if you'd used it.
And then the last video mentioned a website at the end. So I guess that's the Genesee, Wyoming County, Wyoming, Orleans County. Can you put that website in the chat?
Oh, I'd have to look for it. Oh my gosh.
Or if you email it to me, I can email
I'll
it out to
email it
everyone.
to you if you don't mind, because I don't want to lose the video by messing with my computer.
Okay. All right. And then for people that have been trained, I know that you've offered to, we're all gonna receive one in the mail for being at today's training. I know in Monroe County, if you call them, you can come in and you can pick up some Narcan. They will bring it out to you. How else can people get more Narcan kits if they're expired or if maybe they've used them?
There is, most health departments, I can't speak for other counties other than the 3 counties that I'm in. The health departments in the 3 counties that I work with, Genesee, Orleans, and Wyoming, all the health departments have Narcan. Jacasa, Spectrum both have Narcan. I have it, obviously. Pharmacies, and that's why I talked about the NCAP program, is they have it as well. And you can go in as long as you have a prescription coverage plan on your insurance card and receive it. And what I'll do, Laura, is when I give the information or give the kits to R-AHEC, I'll also include a card for the NCAP program and the kits.
That would be wonderful. Thank you so much. I
Okay.
don't see any additional questions. So I know today we're ending a little bit early as long as there's no other questions. But Charlotte, thank you so much for your time and for this informative presentation. I know I've learned a lot, but we have one more question. Hang on. Do we need to bring any paperwork with us when we request more Narcans? Good question.
Here's what I'm going to tell you. If you go to a pharmacy, they're not going to ask you for anything. If you want me to replace one, and this is like my carrot, okay, bring me in, if you've used it. If you have used it on somebody, I'd like to have the Narcan utilization form back so I can get the data. That is the only thing, but only if you're in Orleans, Genesee, and Wyoming County. Otherwise, scan it and send it to the state, and they'll count the numbers so they have the data.
So just now the comments have thank yous, and thank you so much for the refresher and the update. So again, Charlotte, we appreciate your time today and your presentation, and to all of you that have joined us today, thank you for being with us for this entire series. We started in January, so today we're done for the season, and we hope to bring you another session, another long series again next year. So everyone take care, enjoy the summer, and we'll see you next time.
Thank you, everyone. Thanks, Charlotte. Great job.
Thank you. I appreciate you letting me do this. Thank you.
Anytime.
Okay, bye-bye.
Bye.